someone you know has missed a day because of pink eye. That may be a dying trend. A recent report from Mayo Health indicates children with the virus can still go to school the next day. News 8's Alec Johnakopoulos is here with a look at how pink eye is treated.
Mike, antibiotic pink eye drops used to be the go-to way to treat pink eye, and while in some cases it still is required, better understanding of pink eye has revealed that drops aren't usually the best way to go, and students with pink eye may be able to keep attending school.
The growing overuse of antibiotics has led to Mayo Clinic changing course on its pink eye protocol.
Research shows that pink eye, or what doctors refer to as conjunctivitis, is often a viral infection and doesn't need to keep a child home from daycare or school.
Because pink eye is a virus, much like a common cold, antibiotics are not the best treatment.
It isn't a reason to stay home, so just like we let kids go to school and daycare if they have a runny nose, they can go to school with pink eye.
Prior antibiotic eye drops that schools required children to take were found not to be effective, having school nurses change their protocol.
We follow our Wisconsin communicable disease chart guidelines. We have a nice big colorful communicable disease chart, and on there it does say that they don't need to be treated before coming back to school.
But there still are cases where a child with pink eye may be better off at home.
About the only time we send a child home is if they're struggling to keep their hands out of their eyes, if they're so miserable that they're itching and scratching.
The inability for some children to prevent scratching or touching their eyes has Gunderson Health still advising a child stay home the first day to recover.
Given how highly contagious pink eye is, it probably is in the student's best interest and the school's best interest for that child to stay home.
So while both hospitals differ on an opinion if a child should go to school with pink eye or not, they both agree letting the body cure itself is the best way to treat pink eye.
Most cases of conjunctivitis are self-limiting, so they cure up relatively fast without any treatment.
Despite recent developments, there still is some gray area on if your child should stay home if they contacted the virus.
And so what can help parents decide if they should keep their children home or not?
Well, mother or father still knows best. If your child is uncomfortable, is generally unable to focus, to learn, or is overall just in a bad place because of the pink eye, you should still keep them home.
Okay, thanks a lot, Alec.